So why don't we start with who we are talking to right now?
I'm Dan Zanotti, one of the orthopedic surgeons at the Center for Orthopedics. I have a specialty in shoulder and elbow arthroscopy and sports medicine, and I take care of patients of many different ages.
Awesome. And yourself, Matt?
I'm Matt Frombach. I'm the administrator at Center for Orthopedics.
Awesome. So this is our first foray into the idea of maybe having something where we kind of talk with the docs about topics that relate to medicine or orthopedics and that sort of thing. And we'll just see if people find it interesting and what comes of it. So I'm super thrilled that you're willing to give this a try and see what happens. So why don't we start, Doctor, can you give us an idea of something that you've seen this week that was particularly interesting as far as a patient is concerned, or some sort of injury that you've seen recently?
Well, we've certainly seen a lot of increase in summer trauma cases. You know, people have been excited to be out and about this year, certainly more than last year. And the unfortunate side of that is people also get injured, but that's why we're here. And the trauma cases and the fracture care are always something that we are happy to help take care of.
So what is a very common summer injury that you see a lot that people might not realize is something that happens?
Lots of wrists and lots of ankles. Those are probably the two most common, whether it's kids playing, falling down, sometimes an elderly person will fall, but those are probably the two most common things we see. Unfortunately, we also see a little bit bigger injuries like femur fractures and tibia or shin bone fractures. Those are unfortunately a little more difficult to take care of and require more hospitalization type care. But again, that's something that we see a lot when people are out and about being active.
Yeah. And are these of all ages, or are they particularly people that are doing sports, or how does that work?
Younger patients are more sports oriented. So we're seeing those with the football type injuries and soccer injuries now and in this time of the year. So some knee injuries, some ACL injuries from the athletes. But the older patients, when they fall, they can hurt anything. Again, whether it's a shoulder or a femur or another injury. Unfortunately, they're a little more fragile as we get older and we tend to break more things.
So as far as older people are concerned, do you have any tips to reduce summertime injuries?
I think some of it this year is just because people were so inactive last year. So they're more enthusiastic about being out. They're more likely to take a few risks when being out, and maybe even a little bit more deconditioned when being out, from not being out, I should say. So trying to remain active is always the best bet. You want to keep your health up. You want to keep your fitness level to a certain degree, so you're not more susceptible to these type of injuries.
So do you recommend like full body exercising, or just to keep yourself fit, or do you just like walking, or are you not particular?
No, it can really be anything. It's just encouraging people to be active. Walking is great. Swimming is great. Biking is great. Any of these lower impact activities for our older patients are really helpful and also easier on their joints. So we really just try to encourage them to be as active in whatever way they want. I mean, obviously doing weightlifting and things like that as you get older can have some benefits in terms of maintaining strength. Fitness and diet go together. So, we do see a fair amount of obesity in our culture, and we would definitely recommend you try to take care of your weight to preserve your joints as well. So it can be both exercise wise, nutrition wise, and overall health wise.
Yeah. So do you, if you take somebody, say, for example, that's overweight, older, maybe mid 50s or up, and really sedentary, but wants to do something good with themselves. I'm thinking of myself. Like what would you say to do? Would you say, start walking? What do you think?
Yeah, walking is a great exercise. It's got tremendous benefit, and it's not that hard to do. Now, you start slow and you start small and you build yourself up. You don't want to go walk a 10-mile walk the first time you've been out all summer, but that's certainly an easy way to start. And then you can graduate to a little more advanced, like riding a bike or getting in the swimming pool, which is also great exercise. But it's really having that desire and that goal of becoming a little bit more fit that's important. And again, we encourage that for many different reasons.
Are you a fan of stretching? Do you believe in stretching?
Absolutely. And I can tell you that I'm guilty of not stretching enough. I'm going to probably pay for it as I get older, but it is very important. We all get tighter as we get older. We all lose that flexibility, which makes you more prone to muscle tendon injuries. So absolutely, stretching should be a big part of anything that you do. And even if nothing else, if you're not going to go walk or exercise that day, spend 5 or 10 minutes stretching.
Yeah. And so now, like with the younger people, maybe younger people that are involved in sports, and is it still a lot of that wrist and ankle stuff that you're seeing with those guys?
We do. And, again, the knee injuries at this time of year start to pile up because of soccer and football and the more cutting, twisting, turning sports. So unfortunately, there is a lot of that out there in our athletes today. Some of it you can't control when you happen to be cutting or twisting and you get hit on the side. There's not much you can do about that. But this is certainly ankle time of the year, wrist time of the year, and knee injury time of the year for our school-aged athletes, unfortunately.
Is there anything you can do to prevent that when you're out there?
No, there has been a lot of recent data on ACL prevention in particular, trying to do some exercises and other sort of sports training to stabilize your knee. And in particular, women and girls can benefit from that tremendously based on their alignment issues. So there are some things out there in terms of ACL prevention, which has been shown to help. It takes a little bit of time and work and sometimes some investment to have access to those sort of programs, but certainly that's of interest.
Like can you talk a little bit more about ACL prevention? Like what does that mean exactly?
So in particular, women tend to have a little bit different anatomy than men, obviously, but from a leg standpoint, their hips are a little bit different, their knee alignment is different, and their muscle mass is different. And it's that combination that we think allows the ACL to be stressed more. We know from data that women and girls are 3 times more likely to tear their ACL than boys. So, the question is why, and we think it comes down to that alignment issue and muscular imbalance. So if you can target those, obviously you can't necessarily change somebody's hip alignment, but you can target their muscle mass. You can target how they land from a jump position or how they extend from the ground. And those things have actually been shown to help. So there are prevention strategies to try to maximize muscle strength and even flexibility that have been shown to work.
So like you said, landing, do you see a lot of these, say in gymnastics in particular, or is it just all across the board?
Surprisingly, you don't see a lot of ACL or knee injuries in gymnastics, and you would think that you would. It may be because of their innate strength. Gymnasts are quite strong and flexible, and they also land on relatively soft surfaces, which tends to help. So you don't see it as much in gymnasts as you would think. What you really see it is the cutting, twisting, turning sports, basketball, soccer, football, for instance. So in those particular situations, trying to maximize your strength and flexibility as you're getting hit or as you're cutting, twisting, turning seems to make a difference.
Do you find that people put off going to see you when they should come earlier, or like how do you see that play out?
Yeah, and I'm going to ask Matt this question too while he's here, because he keeps track of all of our numbers and he can tell you what's happened with the pandemic in terms of people coming in and not coming in. So Matt, feel free to comment on that.
So initially, when the pandemic started, there was a lot of people didn't want to come in because they were afraid of getting sick. But what we have seen, especially this past summer, actually this past month of August, we've had more walk-in injuries through our walk-in clinic than we've ever had. So we set a record in August. So I think it kind of goes back to Dr. Zanotti's point of people are getting back out there and are maybe doing some things that they're haven't been doing in a while.
And I think what you're seeing, Sage, is that there's people who are still obviously afraid of going to the hospital, going to the ER. That thought is in their mind with the pandemic, but now they're being more active and trying to get back out there, and they're still injuring things. So they don't want to go to the emergency room. They're still injuring themselves. And what do? And what we've seen is that our walk-in clinic has now become a pseudo emergency room where you can get musculoskeletal orthopedic care without having to go to the ER. And in many ways, it's more efficient. It is much more efficient for the patient. It's much more efficient for the healthcare system. You don't have a double cost of going to the ER and then to see a specialist. So, in some ways, it's been very helpful for patients to realize they have that ability.
So that's really pretty cool. I've always thought that your walk-in center is amazing. Can you talk about that? Like literally you just walk in?
Matt, go ahead. You can address that.
Yeah, you can literally just walk in and we'll see you. There's other ways at access points. You can call and get an appointment. Typically Mondays are our busiest day of the week just because it follows the weekend, and all the weekend warriors, as we call them, are out being very active. We still get a lot of follow-ups from people that go to the emergency room first. But that was just kind of what we're saying is 99% of the time when you go through the ED, they're going to say follow up with an orthopedic specialist anyways. So you can just literally walk in, you can call, make an appointment. But if you have an injury that needs to be seen and taken care of, we will see you today.
Yeah, it's pretty unprecedented to be able to walk in and see a fellowship trained orthopedic surgeon without an appointment. If you've ever tried that at one of the major institutions, it's really impossible. And that we have that ability, which is really unique and something we're very proud of. It takes a lot of hard work on our part to be able to do that and to accommodate patients like that. But it allows patients to be seen very quickly, to have decisions made very expeditiously and get their treatment done nearly immediately. So we think it's a model that really works well for patients. They certainly like having that ability to do it. And it's not perfect by any means. Sometimes on a busy day, like a holiday weekend, we get overwhelmed a little bit with the number of patients walking in, but it's still a service that we provide, and we're very proud to provide that to our community.
Yeah. So is there a time where, like, let's say you think you've broken a big bone, like you talked about the femur or that sort of thing. Should you go? What should you do then? Should you go to the emergency room, or should you come see you? What do you think then?
Yeah, that's a great point, Sage. Yes, there's always a time that you need to go to the emergency room. If you're having a heart attack, if you break a bone and it's sticking out of the skin, you need to go to the emergency room for that. But for strains and sprains and things where you think you can maybe put some ice on it and it's not getting better by the next day, those are perfect examples of things you can come to our walking clinic and be seen right away for. But certainly any emergent case where you can't walk or you can't function in a normal way, the emergency room is always your best bet.
Yeah.
So I don't know if this is appropriate for the podcast, but I was getting my hair cut and the barber, she saw on my shirt, it's like, "Oh, you work for Center for Orthopedics?" And I said, "Yeah." I said, "Yes." And she goes, "Yeah, one of your physicians, sewed my finger back on." And her index finger was 3/4 cut off. She goes, "Yeah, it was my 21st birthday." And, she got her finger slammed in the car door, and she brought her finger to our injury clinic. And I was laughing because I was like, we were talking about that patient that week. This was about a year ago. And she said, I thought my life was over. It was crazy, but you guys took great care of me. And, it's just something that you see the gratitude of the community.
Now she's cutting hair again. I think she missed a spot. I'm out.
So I would have never thought that would fall into your realm.
No, she brought, it was our staff was caught off guard because she actually brought her finger with her in ice.
So probably not the best example of what to come into the walking clinic with.
Maybe we need to edit this out.
No way. I mean, maybe a cautionary tale. Maybe don't do that, but you did.
But we always have the ability to send you to the emergency room too. So if it's something like that would need more emergent treatment, we can make that happen as well.
Yeah. So it's like I've seen people do that at my local CVS Minute Clinic. Like they walk in and they're like, "Hey man, you need to go get in an ambulance." So, it's good to just go somewhere, I suppose, right?
You're exactly right. And with the pandemic last year, people were so afraid to get access to healthcare and with the virus and things being around the hospital, that we've really avoided healthcare, which is not a great thing. Whether it's a heart attack or something else, we need to be treated preferably sooner rather than later. The longer you wait, the worse things are going to get. So even if we can't treat it here, we can triage you to the right person, the right specialist, the right place to get your treatment as you need. And then that's really a unique setting to be evaluated by fellowship trained surgeons and doctors in that sort of quick minute type setting.
Yeah. Okay, let's come back to I'm going to be 50 this year, actually. And I'm trying to, my wife really wants me to exercise, really wants me to get out there. Do you think, like, I've read, I'll see, ask your doctor if you should go exercise. Like if I wanted to start an exercise regimen, is it good to go talk to a guy like you first, or
Yeah. Absolutely. I mean, talking to anybody is good in that regard because you need a plan, and no plan, whether it's a dietary plan or an exercise plan, is going to work if you don't have a goal and if you don't have some information. So, we can help provide all of that stuff. Certainly, we're educated on exercise regimens. We can have access to dietary specialists if you're overweight, looking to work on a weight loss side of it. But getting a plan and a program together is the first step, and anything you can do to encourage that, including talking to a sports medicine specialist, is going to be helpful to you.
That's awesome. As a man, a middle-aged man, I'm always embarrassed to go to the doctor. I'm like, I don't want to bother him. I don't, this is nothing. Do you see a lot of guys like me that like put it off, don't come, and then end up in a really bad spot?
Yeah, absolutely. I'll give you an example. I see people with a rotator cuff tear all the time who had an injury 2 years ago and just never sought treatment. And the problem with some of those injuries is the tear worsens over time. And what was once a fairly fixable tear can become something that's no longer fixable. And that's devastating to a young person who's a laborer, who's active, trying to play with kids or grandkids. So you don't want to let something that can be treated linger until the point where it can't be treated any further. It's also interesting. People come in all shapes and sizes, and we have other patients who come in for every little bump and bruise, and they're great, and we love to talk to them. But there's people who are not afraid to utilize our access for whatever reason, whether they like it just coming in from a social reason or that reassurance that no, the little bruise isn't that big of a deal. So we see people with all different mentalities, but certainly the ones that put it off longer and longer tend to have more complications and more problems.
Yeah. So let me ask you about this rotator cuff thing, because I've known people that have had this. What are some signs of that where you're like, man, you better go see somebody?
Typically rotator cuff injuries take an injury. You have to have something happen. You lift something, you fall, but not always. Sometimes there's simple overuse phenomena where you just years and years and years of beating up your shoulder. But when it gets to the point where you can't lift your arm overhead, when you're having persistent pain lifting or doing activities, a lot of pain at night. Rotator cuff pain oftentimes bothers people more at night trying to sleep. So those are just little tip-offs that you've got something going on that isn't going to get better. And again, even if it's just a quick evaluation to say, hey, your shoulder's going to be fine, that's better than putting off something that really could be treated better now than it can be a year or two from now.
Okay, I've just realized this is the greatest thing ever for me because I can just ask my problems. So I sleep, I'm a side sleeper, and I find that my hip hurts when I sleep on the side. Is that something you guys see or?
Very common, Sage, especially again, as we get older, getting back to your point about flexibility, that's typically a bursitis or an inflammation around the hip joint. And one of the muscles that runs over the side of the hip tends to get very tight. So we see that a lot. Typically that responds to some stretching, aggressive stretching, occasionally a cortisone shot. But it's one of those very, very common things we see, hip bursitis. So there you go. We got you figured out.
I love this. This is the greatest idea ever. Us doing this podcast. All right. Well, I think this is really cool. I don't want to keep you, doctor. I mean, how many people do you see a day, would you say?
70, 75 patients a day typically.
Wow. Okay. So you need to go relax or something because that's a lot. But I would like to maybe do this more often. Did you find this?
Yeah, I think it's a great format. You got great questions, very conversive and easy to flow on a number of different topics. So I think it's a great way to do it. Now, I think some editing obviously will help too, but I like the format. I think it works well.
People love you guys, particularly you. I mean, I see on Facebook the love they have of the doctors at Center for Orthopedics, and I think this platform where we can talk casually and understand these things is just a great opportunity for us all. So thank you.
Let me ask you this: when you put these up, do people leave comments about them?
Well, I don't know if you ever go to the Facebook page, but people comment all the time, man. They love, you have fans. You literally have fans.
I just wonder if it would be worth, if you call it Talk with the Docs or something like that, if people would want to leave questions that they would want to see addressed on future podcasts.
I think that's a really great idea. And, we could even, I'm always thinking ahead, but like we could do this live where people could come in and type in on Facebook a question.
My only scary thought would be that there's nobody listening and you sit there and
I
chirp,
know.
chirp. Anybody have a question?
Warren's gonna be long time listener, first time caller.
And then you get a prank call or something like that.
I mean, this is probably the longest I've ever gotten to spend with talking to a doctor. Like, this is wonderful. So like, I think, that's not true. I have some really good, but I mean, it's hard. You guys are so busy and we don't always have a lot of time to access you. So I think people would love it.
Yeah. Well, so let's find out. Let's throw it out there and see what happens.
Maybe we should try a live Facebook one.
I'm happy to do it.
Wow. Okay. Do you want to just try meeting like this, like once a week? Do you want to?
Yeah. The only issue is sometimes they have meetings over lunch, but yeah, we can figure it out.
We can figure it out. And then this is an open forum. You've got this nice table. If other doctors want to come, anybody wants to come and sit in, I suppose, right?
Yeah, absolutely. We have a few other specialties we can get in.
Yeah. Yeah. And I've seen YouTube, videos of doctors that show stretches and that sort of thing. I don't know if we want to get into that down the road or.
Yeah, there's a lot of colleagues that have websites do that. They have tons of informational videos. We kind of have that with our therapy department, who provides those video links to all of our patients, like all of our pre-op patients having knee replacement, shoulder replacement, et cetera, get to watch a video link of what's going on and afterwards. So we haven't done that on our side simply because we have access to the therapy side of it, but
yeah,
certainly out there if we wanted to use them.
Yeah. Well, I think if we open it up to other people, like to potential patients, a lot of times they'll lead the way of these conversations and they can be pretty interesting.
Yeah, we could even do one of these with a therapist, have Brittany or somebody, our head therapist, come down and, talk about knee replacement or hip replacement or shoulder replacement and what to expect afterwards. What's the therapy like? What's the recovery like? And
that's an awesome idea.
Just to encourage more people with conversation. I think it flows better back and forth if two people are conversing, or 3.
100%. Yeah. It's just a wonderful opportunity. I'm so thankful that you're willing to take the time, and obviously you're incredibly busy. So
Good
this
stuff.
is great. Thank
Appreciate
you.
your help.
All
I
right.
appreciate it.
Thank you.
Okay. Thank you, everybody.